Hi, this is Dr. Yass here. I'm here with a new patient, pretty much resolved patient, Darcy. Just say hi, Darcy.
Hi, I'm Darcy.
This is her husband, Tom.
Hi, I'm Tom.
And Darcy came a long distance to see me, in fact, cross country. And how did you find out about me? Because this is actually kind of an interesting concept.
Actually, I stumbled across the book while I was watching YouTube. A lady was rating books that she had read that year, and she held up this pain book, and she said it was just an awesome book. It would change the world, and everybody ought to read it.
And what was her name? Her name was Sassy Pineapple. So thank you, Sassy Pineapple, that you were able to get Darcy to come here. And Darcy had some pain in the gluteal region. She had it since 2011. She had tried multiple mechanisms for resolving her pain, was unsuccessful, had become heavily involved in using pain medication, and she was just looking for a way out. It got to the point where they were thinking of now reducing the level of pain medication she was taking. So she felt like she was at a point she really needed to find something. She saw the video on YouTube, decided to reach out to me, and she came here. And just want to tell people a little about what I kind of gave you the impression was the cause of your pain and what we did to make it go away.
Well, it just seemed like I had been bedridden for almost 5 years, and I was in such desperate pain. When I saw the book on YouTube, I bought the book and I came here, and Dr. Yass, that very day, he had taken a lot of the numbness away from my foot. I was experiencing sciatic pain from my hip area all the way down to my foot, and I couldn't walk hardly on one foot, and I was in a wheelchair a lot of the time. We flew out here from California. We used a wheelchair back and forth from the airplane to the airport, and so I really couldn't walk, and I spent most of my time in bed when my husband would go places. We came here to see Dr. Yass. He did some tests that to see what my range of motion was and how weak I was and what I could do. He did some massaging in my back area. He massaged the weak muscles, and
What did I say was the cause of sciatica?
the sciatica, he said, was that the gluteus medius muscle right here in the hip had become so weakened that the piriformis muscle had kicked in to take the load, and it had also strained, and so it had bunched up and become like well, I like the way he explained it. He said it's like spaghetti, that when it gets cold, it bunches up in clumps, and that's what it had done, and it had pinched my sciatic nerve, sending tremendous pain down my leg, and I had lived with that pain for 5 years, and they had me on strong opioids and strong medicines, and then they were going to take it away from me, and I was just so desperate that I reached out to Dr. Yass, and I just feel like, man, he just gave my life back to me. He just really did.
And how's your symptom level now? She has been here for 4 days. She's had 4 days of treatment. And let her tell you, how do you feel your symptoms are now?
The numbness in the foot has practically almost all gone. The pain is gone. I can walk and I can get out of bed. In fact, my husband and I, we don't spend our time in a room anymore. We can go out and sightsee, and I feel great. I'm not in a wheelchair constantly. I feel wonderful. I feel like he gave my life back to me.
And Tom, what do you think? What do you think about the change? What do you think about the system?
Well, to me, it's amazing, but one of the things that appeals to me is that it's logical. And for 5 years, a major medical chain that Darcy belongs to was unable to identify the problem. They did about 3 MRIs and poked around a lot and had her see a lot of doctors. The first doctor she saw as a back specialist told her, there's nothing you can do about it, you're just going to have to live with it the rest of your life. She didn't like that, so she went to see a second back doctor. He said, well, you should try other things. Try acupuncture, try acupressure. And so she did try both of those. She saw 2 different chiropractors, and nobody correctly identified the cause of the problem. And so finally, the medical facility said, we don't see, there's nothing wrong with your back really, so we can't operate on you, which they probably would have if they'd seen something, even though it wasn't the cause. So they pretty much told her that, well, you're suffering from chronic pain, which means that your mind is causing you to experience this pain. Your mind is so used to you to being in pain that it's just frozen in that mindset, and you're stuck with it. And so we'll help you learn how to manage your pain. And then they told her they're going to start taking away her pain medication, which is the only thing that was managing it. And they really hadn't even tried to determine the cause of the problem. In Dr. Yass's book, he explained that a large percentage, like 90% of pain, is caused through overstressed muscles. And he's identified various types of pain and various parts of your body where you might feel pain. And he has a series of tests to identify which muscle may have been strained. And then a series of exercises that you can go through to strengthen that strained muscle that will relieve the pressure on your nerves or the strain in the muscle or whatever, but basically to get rid of the pain. And that's what appealed to both of us when we read his book, because we didn't know if he was right or wrong, but he was the only person that had presented any type of a logical explanation for the exact pain Darcy was seeing. So we figured it was worth a try to find out, and we're glad we did. It was really emotional the first day to see her relief from 5 years of pain. It was amazing.
So, what would you say to anyone who's in pain, who's been told it's a herniated disc or stenosis or a meniscal tear or something that's found on an MRI? What would you say to someone like that? Should they try the Yass method to get the real answer?
I think that they should. I think they should buy Dr. Yass's book and read it, and they should contact him and do what he says, because it really works.
Okay.
My husband and I were just totally overcome with emotion, and we're just blown away. We just are. That it could be resolved in a matter of 4 days instead of 5 years. It's just amazing. It's just amazing.
And it wasn't even resolved in 5 years.
No.
All right, so that's just one person who's come here. There's been thousands, and the goal is simple. I just want to resolve chronic pain. I want people to get the answer. The only way to really understand the answer is to identify the proper tissue, and as far as I'm concerned, the only way to do that is through the Yass method, with its attempt to interpret symptoms as the way of identifying the cause of pain versus the use of diagnostic tests, which are clearly invalid, will never resolve or identify the proper cause, and in 90% of cases, people are being misdiagnosed. That's why no one's getting better. So please find the Yass method. You can come to my website at www.mitchellyass.com. You could reach me at my email, drmitch@mitchellyass, Dr. Mitch at mitchellyass.com. Get the Yass method, resolve your pain. This is a great example of what it can do and how it can change your life. Again, this is Dr. Yass. Thanks. Bye-bye.